We're talking with Dr. John Hollister, a pediatrician at Dartmouth-Hitchcock Manchester, about some questions parents may have about immunizations. Most parents understand that there's a recommended schedule for vaccinations, but what we might not understand is whether there's any flexibility with that, or this always happens at this date, this always happens at this age. In your practice, do you allow parents and families to say, we don't feel ready for that one just yet, or we're interested in doing some of these vaccinations but not some of these other ones?
Okay. Our practice definitely feels that taking care of your child is a team approach. It's not just the doctor that's taking care of the child or the parents that are taking care of the child. It's all of us together, and vaccines is one of those aspects of it. So. I definitely think that a majority of the doctors in my practice or in most practices will say that as long as your child is eventually gets immunized and things along those lines, we're definitely willing to work on you as far as like what schedule or what pattern you want to give vaccines in. There's a recommended pattern. There's a recommended schedule that the CDC recommends and the AAP recommends that a majority of doctors' offices will follow pretty closely. Partly because there's a defined amount of time that has to be given between vaccines, so we need to keep track of that so that we don't give a vaccine too early and therefore it doesn't count and things along those lines. But also because, honestly, we want to build up the immunity fairly quickly because the longer a child goes without getting those vaccines, it means they're still at risk for getting one of those diseases. So one of the reasons why we do it sort of fairly regimented and fairly scheduled is to try to get the vaccine done and get their immunity up and running so that they aren't at risk for those things.
Do you find that some parents are concerned about vaccinating their children at all?
Absolutely. I think that anytime anything is introduced in the body, I think people have concerns that maybe it might do more harm than good. It's not my experience with vaccines. My experience with vaccines is that obviously we're preventing a lot of bad diseases and really creating a healthier society as a result of vaccinating. But I definitely think some people have that view of it.
If parents have chosen not to immunize their child, do you refuse to see them at your practice?
Not at all. I mean, from my perspective, this is one of the best places to be because if a child is unimmunized and they do get sick, what's nice about Dartmouth-Hitchcock is I feel that we are very up to date as far as like what the most current treatment strategies would be in terms of that sick child. And we would take into account the fact that they're unimmunized against some of the things that we might be concerned about. A classic example would be a child with a significant fever who has not had some of their childhood immunizations early on. They're at risk for a lot of different things, and sometimes we have to really be more aggressive in terms of our fact finding, whether it be through blood work or chest X-ray or considering different medications and things along those lines. So I think it's one of the best places to be because we take all that into account when we deal with the overall health of the child.
What are some of the common concerns that parents have about immunizations?
There have been a number of concerns over the years. Earlier on, there was a lot of concern about mercury in the vaccines. And there's no question that looking back at the vaccinations early on that contained mercury as a preservative, that it was not a good idea to have mercury as a preservative. So the nice thing is now no vaccines now, or very few, at least no vaccines that we use in the childhood group can't contain mercury anymore as a preservative. People have been concerned over the years of an association possibly between the MMR vaccine and the autistic spectrum. And if you look at the AAP's websites, you'll find numerous studies that have been done over the past 5 to 10 years, which have shown no correlation between the two. So sometimes it's hard because kids will come down with something, and within 6 months of having a vaccine, and people think that maybe that what they came down with is a result of the vaccine. But there's also been 6 months of other things that have been going on with that child during that time. So I think that sometimes immunizations take a bad rap. I think that people blame them for things that maybe were there for other reasons.
I know in talking with many physicians over the years, they're very used to, and perhaps you've experienced this as well, patients, parents coming in armed with information that they found, perhaps at a library or certainly now off of the internet. Do you have anything you would say to parents in terms of evaluating information and evaluating sources of information? Because it seems like there's any argument, any point of view can be found out there on the internet. Anyone can advocate in any particular direction.
The internet can definitely be like my best friend and also my worst enemy at times. It provides a wonderful resource for parents so they can actually make informed decisions about a lot of the things as far as their children are concerned. The hard part is that you really will get sometimes very mixed information out there. As a doctor, I try to make decisions based on sort of, research and science and what I've experienced with my own patients in the past. And some of this information which is on the internet isn't really based on that sort of information, and it can be difficult to really assess like what the results are that the internet's recommending, or what the information that they're using to make decisions is. But I don't discourage parents from using the internet. I definitely think it's something that becoming informed, and then asking questions afterwards, and truly trying to evaluate, the source of the information, or bringing those ideas in so we can discuss them, because the internet. It's a massive information base, and there's information out there that that's beyond my scope as a doctor, beyond my scope of what I've learned. But I'm always willing to learn more about it. So oftentimes parents will come in with websites that will sit down and discuss, even look at in the room and discuss the information, and try to come up with, once again, good information and good decisions as far as being part of their healthcare team.
What are some good sources that you know of for information online about vaccinations?
So I like the AAP website, which is the American Academy of Pediatrics. I think it's really the bread and butter of most of the information out there. The CDC, the Center for Disease Control, also has a lot of very good information, both about immunizations as well as just the overall health of your child and things along those lines. So those are two big organizations, and that's where I do most of my reading. But once again, like anytime you Google anything, you will get 100 other websites or 1 million other websites that'll have sometimes similar information, sometimes not so similar information.
So if my child misses an immunization or misses a well-child appointment, do we need to start all over again with the cycle of immunizations?
One of the wonderful things about vaccinations is that it's a building process. So the reason that we give so many boosters over the first 2 years of their life, or for that matter, continue to boost things throughout life, is your body is amazing at remembering things. So even if you get off schedule, or if you choose to do a schedule other than the schedule which is recommended, it's something that you don't have to necessarily to repeat vaccines. Your body just continues to remember and build up the new immunity each time it's based on. There are some vaccines that are given like in a certain time period in your life. So for instance, if you've missed it early on, maybe you might in later life only need 1 or 2 of a vaccine instead of getting the full 5 or something like that. But a majority of vaccines, even if you take a big break within it, you just start where you were and just continue the vaccination course at that point, and your body should build up a perfectly good immune system to it.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.